Thank you for joining us. My name is Brittany Hun,
And my name is Mia Meza.
and we will be presenting about Avenue, otherwise known as the Antelope Valley Engagement Network United for Equity.
So these photos right here that you're looking at kind of show our partnership with DHS and DPH. To begin with, Avenue was founded in 2020 with the support of the UCLA Pritzker Center for Strengthening Children and Families to provide all families in the Antelope Valley with high-quality, trauma-informed care. Avenue represents staff from Los Angeles County Department of Health Services, and it's dedicated to achieving this through collaboration with other Los Angeles County agencies. So, with our partnerships with DHS and DPH and their mission to increase access to healthy foods in the AV, we have partnered with LA Regional Food Bank, and we host once monthly no-cost fresh food distributions outside of High Desert Regional Health Center in the Antelope Valley Wellness Center, and we do this with support with Dr. Lisa Gantz. Other students and I have actually volunteered at these drive-through distributions where the team helps give out 30 pounds of fresh produce to each family. In 2021 and in 2020, Baby to Baby graciously donated diapers for many of these events, and we have unpacked and gave out hundreds of diapers of all sizes at these distributions.
So through staff education, community asset mapping, and engaging with our medical neighborhood, we aim to foster greater connection, collaboration, and community between DHS health centers and community partners to improve health and well-being of all members of our Antelope Valley community. So Avenue tries to integrate the 3 pillars of education, integration, and engagement into all the work we do, and we'll get into each kind of pillar in our next slides.
So big question is, why the Antelope Valley? So the Antelope Valley consists of 400,000 residents and is continuously growing today. And the Antelope Valley Medical Hub provides forensic services, consultation, and primary care for children with active DCFS involvement. But many of the wraparound and support services offered to Hub patients are not available to children in the region who may be facing challenges but are not yet DCFS involved. Unfortunately, the general pediatric patients currently have limited access to social services and case management support at DHA sites. And many pediatric providers actually lack sufficient training or familiarity with resources and community-based organizations to successfully refer their families and their patients to these needed services.
Yeah, so we wanted to combine all the resources and kind of community organizations already out there in the Antelope Valley. So as part of all 3 pillars of Avenue, we've created a social media page where youth, especially transition age youth, can access information about free events and resources in the Antelope Valley. We want you to be able to have autonomy, independence when it comes to their healthcare and what they can access. And so providers at the health clinic will send their Instagram over or show these resources that we've compiled together. And as a college student myself, I can say we use a decent amount of social media. So we figured this would be a quick and easy way to access after they see their providers and kind of check things out. So we post both on our stories and create permanent posts, but both can be accessed anytime. The highlights show various job opportunities, resources, food resources, mental health resources, and local volunteering opportunities to get involved in the AV. And we also take posts that other community organizations have already created and post them and highlight them so we can show that collaboration and that we're kind of know what's going on in the AV, so like everyone can see everything happening. And for example, we post Penny Lane Transition Centers, Tay drop-in calendar each month, and the Antelope Valley Partners for Health youth events.
And now we're going to talk about the AV Health Neighborhood website. So through the Avenue project, we have made many partnerships. A big partner of ours is actually the AV Health Neighborhood, or Antelope Valley Health Neighborhood, which is a community collaborative to improve access to care and increase the health of residents in the AV. The Antelope Valley Health Neighborhood brings together health, mental health, substance abuse providers, and community organizations to establish and enhance collaborative relationships and promote the integration of whole person care. As a result, we support the AV Health Neighborhood in a multitude of ways, starting with the revampification of their website. We utilized our MailChimp platform to create an easily accessible, organized, and eye-catching website where all users can easily navigate. In our website, one can learn more about AV Health Neighborhood and can easily be directed to learn more about Avenue and the Pritzker Center. Furthermore, users can access our newsletter and subscribe themselves to it, follow our social media pages, add our calendars strictly to their devices, contact us, and even read more about DMH Service Area 1, where through Service Area 1, community members can learn about our monthly meetings and directly access them through our website and much more with just one click.
And similar to our social media page, the AV Health Neighborhood also has one, so we also help run theirs. We help with their newsletter and their website, like Mia said, and it's very similar to our Avenue website. And so these resources are more geared towards families and providers, but all ages can benefit from these things. And there's a large emphasis on food resources here on this page and career opportunities for folks as well. And then to help both Avenue and Health Neighborhood, we've created some merchandise to hand out to folks at the grocery distributions. We fill them up with the produce, diapers, or even toys that Baby to Baby has brought for us as well. And we're hoping that people follow the Instagrams and bring the bags back to refill and get connected with us as well.
And then we're going to further continue our community engagement. So we also hand out our merchandise at community events. On the picture on your guys' left is our Day of Giving that Avenue has been participating for 2 years now. Also, other organizations such as Take Action or schools such as Antelope Valley Community College, which I have attended, have had us come and table at their events where we pass out our wellness journals that you can see here. If you guys all look this way. And then
put it in the Zoom.
Oh, what?
Show them in the Zoom.
Okay. Yeah, where they have us come out to their events and table. We pass out again our wellness journals to help youth. We encourage them to write down their feelings and thoughts. We pass out flyers that we have made in both English and Spanish, and toys as well for the children, and much more while engaging with community members and sharing about Avenue and what we do. These events really allow us to share our work and stories about Avenue, and most importantly, listen to the needs and advice of the community. These events offer a unique experience and opportunity because not only are we sharing our resources to the community, but we are trying to directly engage and encourage transitional aged youth to advocate for their needs. So at these events, we ask them what more could we do for them, and they let us know, and from there, we work with our team to better expand Avenue.
Yeah, and here we have a couple more photos of things we have made and we can give out. Yeah, we have some of them to give out.
We have some, we're gonna pass on our stickers or cards. You don't have to take it,
slide.
but you can see it.
Yeah, a little picture for everyone to look at it. Yeah, and so we have the QR code so they can easily access our website and our Instagram pages. And so if they forget the name or anything, they can just follow us and they can be reminded. Yeah.
No idea that
Flag.
Yeah. Okay, now on to our newsletter that I have briefly mentioned before. We have assisted AV Health Neighborhood, and we have also taken on the responsibility of the AV Health Neighborhood newsletter, where it is updated and sent out weekly. The idea of this newsletter is to provide a place where organizations can send in and promote their events and services. That way, community members or providers can be aware of what is happening each week and month. We are constantly looking for ways to improve this newsletter and are currently in the process of better organizing and designing a new letter. So stay tuned, and if you would like to be added, please access our website where you can easily subscribe, or you can scan the QR code.
The next slide. In addition to the newsletter and the website, we also have a Google Calendar created for folks if they want to have these events and resources like right on their phone, so they can subscribe to a separate food calendar or an event calendar, and we update those weekly as the newsletter comes in, and so you can't miss a food distribution or a community event that you'd like to be involved in the AV. Another initiative that we have for our Pillars of Avenue is creating asset maps. And so I worked with our medical student, Taylor Thaxton, in 2020 and 2021 to create an asset map of community resources in the Antelope Valley through 1 Degree, which is an online community resource platform that allows providers to refer patients to local agencies and programs. So it's similar to like a Yelp for social services, if you will. We created collections to allow DHS providers to refer patients to local community organizations, and created new pages for local agencies that were not yet on 1 Degree. So we contacted those existing organizations and see if they're still offering services, confirm eligibility, and update contact information for them. And so these examples of our resource collections include services for childcare, survivors of domestic violence, housing, food insecurity, and mental health.
Lastly, our community spotlight series. So through our work with Avenue, we also have a spotlight series, which is where organizations in the Antelope Valley can present to the community. These meetings are the first Friday and are monthly. These meetings can occur virtually and in person, and we are constantly seeking out new partnerships and presenters at our community events because the goal is to create a collaborative network. So these are 20-minute presentations. They're from like 8 to 8:40, and again, anyone can attend. They're attended by providers, nurses, support staff from High Desert, South Valley Pediatric Clinics, and anyone who is interested. They're working to expand. So if you know anyone who is interested in presenting or would like to present yourself, you can contact our boss, Dr. Lisa Gantz. And thank you. Any questions?
Yeah. Just a comment, I'm from Palmdale, so I really appreciate my people being served. This is fantastic.
And I'm sorry, did you say you went to Antelope Valley?
Yeah, I actually, I was born and raised in LA. I'm from South LA, but because of the financial crisis in 2008, we moved to the Antelope Valley, and that's where I attended and actually did high school and Antelope Valley College at the same time.
Star? You mean Sword?
Soar.
Sword, yeah, okay.
All right, my husband went to Palmdale, or Highland.
Yeah.
Yeah.
My schooling was weird. I did SOAR and Palmdale High School
Okay.
and
Wow.
ABC. I don't know.
Sword's on the campus of ABC though, right?
Yes.
Okay.
I saw you guys at the event on Saturday. It was fantastic.
Oh.
Really cool event. Really, really appreciate. And I really like the map too, because I will say this for the AV, like a lot of times when you're searching for resources, like you get Los Angeles County, and like it's way
It's
too
out.
far.
That's right.
Like
That's
it's
right.
way too
That's
far
right.
up there. So it's great that the map is there
Right,
to
exactly.
help.
I agree. Can you say, I like the first slide about how the AV is growing. Can you say a little bit about some of the structural factors that are pushing people out?
Yes, so when I said that the AV is growing, it is because LA County, as we all know, the financial status is really, really high, and it forces a lot of individuals to move out to Lancaster, or Lancaster, Palmdale, Little Rock, Rosemont, the entire Antelope Valley community is, let's say, more affordable. But in that terms, we don't have enough resources to support the growing population. And because of that, the resources that are available are becoming overpopulated. We don't have enough providers to see the new incoming influx of children. We don't have enough healthcare services to manage the amount of individuals we have moving to the Antelope Valley, where we only have one main emergency hospital. So when you have these high cases, and I know we're going to talk about this later, but when you have high domestic violence cases, when you have high abuse, we don't have enough services to help every single individual within the Antelope Valley. So that's why this is such a big importance, because we need to bring awareness so that we can continue to grow, bring more providers, and just, yeah.
And something else we didn't put on the slide yet, because it's a little bit in the works, Dr. Gantz is working, it's called AV Up, and they're trying to bring mental health resources from UCLA up to the Antelope Valley for youth and young people.
Yeah, just know that a lot of the stuff that we're working on is not on here because we're trying to continuously grow. So, yeah.
Nice job.
Can I ask, in the time that you have been working with Avenue, what changes have you seen in terms of community engagement?
Yeah, I think that's something we want to work on with Dr. Gantz, trying to kind of check in and see how people are using these services. I think a lot of her colleagues are using the 1 degree that we set up a couple years ago now. I think we're working on updating those things just to make sure things are still happening, and new organizations that have come up in the last year or two. And so, yeah, I think she's been talking with folks at the DHS clinic about that. Yeah.
What's the reception like when you tell people, oh, we're from UCLA? What do they say, and how do they experience UCLA sort of showing up in a community that UCLA hasn't traditionally been a part of?
Yeah, I think even from this past event where they were like, you came all the way from UCLA, and we were like, yeah, they were like, what are you doing here? And so that's when we kind of explained where, oh, we work with Dr. Gantz, and she works here at High Desert, and then Dr. Gantz would mention, oh, and actually Mia's from the Antelope Valley. So then that's when they started connecting the pieces. They were like, oh, so they're like, you guys are from the Antelope Valley, but go to UCLA. We were like, yes. And then So then confusion turns into kind of like like a proud vibe, because even at this last event I shared with a lot of you guys here, where this group of individuals said good things come from the desert, because they had saw that I was from the Antelope Valley and attended UCLA and then was coming back to do community engagement. So they shared that they were like, good things do come from the desert.
That's right.
So yeah.
Represent.
Yeah, that's some new swag. I think we.
Good things come from the valley, huh?
Yeah, I like that. I actually wanted to tell a cool story about sort of UCLA out there. It was because Lisa Gantz is also from from the Antelope Valley, and so when she was a student here, she worked here with us initially through the Pritzker Center, and then in her work out there, she was sort of decrying there's no place to send, not just in the hub, but in their DHS clinics, pediatrics clinics. There's no mental health services for them to refer kids to. And so the kids were sort of, languishing and sort of waiting on wait lists. And so she actually talked to Taylor, who then said, well, we got to do something about this, and talked to DMH, who then reached out to me and was like, Audra, can TIES do something here? So the AV Up is part of our TIES contract now, legal entity contract with DMH. And my colleague, Jessica Jeffrey in our department, is running that. And so literally it's the fastest thing I've ever seen happen on county and UCLA time. And Paisha is the business manager at UCLA TIES, and she now oversees all of these contracts for us, and also lives in the area, so has been to the events, but it's come full circle, and it's all been so well received. So, I mean, honestly, it was like DMH said, we have a problem. Let's see if UCLA can help. And then we were like, okay, let's figure this out. And in conversations with higher ups at DHS, DMH, and with Dr. Gantz on the line, it was like, okay, yeah, let's do this thing. And now they're getting at least 10 referrals a week. They've already seen 79 kids. And it's just starting up. So we're really thrilled that it's all telemental health hub in the AV, and it's really exciting. We're seeing lots of kids and families, and Lisa is super excited and relieved that they have this in place. So anyway, it happened very quickly in terms of county and institutional light speed.
They can move.
Yeah.
Yeah, we see that. Like new organizations are coming up, and they're like, even at this event, they were like, we don't know how to get involved in it. Like we're coming here to a new community, and they're like, we don't know how to connect to the community. And that's when we shared our newsletter, our spotlight series, and they were like, so they come to us kind of to like introduce them, and that's when our medical hub continues to grow.
It's great. You guys are doing amazing work.
We want to thank America for introducing us to Mia. I found the amazing Mia. And we want to thank the both of you for your commitment to the Antelope Valley. It's a place that not a lot of people will drive to, let alone drive multiple times a month or week. And the bridge that you've formed is really impressive. And it's something that, our dean has talked about, that we've heard so many people speak about, and that's because of you. You are the ones that make that possible.
You are the bridge. Yeah.
Thank you so much. Great job, everybody.